The names are all too familiar now. Morecambe Bay, Shrewsbury and Telford, East Kent, Nottingham. Maternity scandals. Babies and mothers who were harmed or who died.
Unless people like us, people like you, the media, maintain acute scrutiny, it just gets swept under the carpet.
Up and down the country, maternity services are under enormous strain. Midwives are leaving a service that's already significantly understaffed.
What it did and what I've seen it do to my colleagues, it's fed into mental ill health.
And the impact is being felt by mothers in their most vulnerable state.
At one point, one midwife came into my room and just burst into tears.
Last year, Rhiannon Davies and Kaylee Griffiths shed tears of relief following the publication of the review into maternity services at Shrewsbury and Telford. They had fought for this following the deaths of their babies at the Trust, Kate Stanton Davies and Pippa Griffiths.
It got worse and worse and worse.
18 months later, frustrated at the continuing number of scandals, they are now demanding a national public inquiry.
Where's the system in this? Where are the systems saying, actually, something's going wrong, seriously wrong, we need to pick up on this? There's not, it's the parents. And time again, we have to put our battle suits back on and say, no, this is not okay. But when is that going to be taken off us? When is the system going to do its job?
A line has to be drawn and change has to happen. So I'm sure, you know, there is no appetite within this government for a public inquiry. Well, that's not good enough. There has to be one.
We were told today that the Health and Social Care Secretary will respond to their call in due course.
Overall rating for the service.
They've backed up their call with an analysis of Care Quality Commission reports. This is the regulator responsible for inspecting and rating healthcare settings, including maternity units. What they have found has led them to declare the CQC inspections not fit for purpose.
As part of my role in the NHS is to look at CQC reports and to pick out themes so that we can learn from them. And I could clearly see gaps and I could see that things weren't quite right and there was a lot of inconsistencies within the reports.
The CQC rates on safety, effectiveness, how caring and how responsive the service is and how well led. They are marked outstanding, good, requires improvement or inadequate.
When you're looking at the rating of a hospital to decide where you want to go and give birth, you should be getting clear details, clear information, and actually women aren't getting clear information. They're getting confusing and conflicting information and information that's not accurate. So what will happen within the report is they will list the key findings of why they've given that rating, and within those it will either say, for example, the medicines were managed well. If you actually look into the main body of the report, it says that medicines weren't managed well.
We found such extreme inconsistencies, as Kaylee's highlighted. So a situation where they say, you know, staff have learned from safety incidents, and then in the next sentence saying, but they can't evidence that. And then you look into the report to see where that's coming from, and they say, you know, there's no evidence that they understand the abduction risks. There's no evidence that the medicines are stored safely.
This report has now been sent to the CQC, and today the Chief Executive said the issues described in that letter are being taken seriously and we are looking into all points that have been raised. I will be engaging with the families directly to provide a full and thorough response as soon as possible. There are, of course, maternity units that function well and safely. At Wirral Teaching Hospital, they say it's about teamwork, supporting each other, and about education, helping those who want to come into the profession.
Passionate about my role and passionate about midwifery as well, and I'd like to translate that to new staff coming through, because I've had 12, 15 years of happy years that I've got fond memory of, and I'd never forget, and I'd love somebody else to have that same memory as I did.
Any public inquiry would need to be asking why it has gone so wrong at those hospitals that we have come to know the names of so well. At the same time, they need to be looking at places like this, asking how do they appear to be getting it so right. And they also would need to be looking at issues like recruitment and retention. How can you build up a workforce to make maternity safer?
A poll of more than 400 midwives shared exclusively with this programme looked at the reasons so many are planning to leave the service. 87% said because of insufficient staff. 78% said burnout, and the same percentage said their workload was too high. Way down the list, around half of midwives cited pay.
It was more about the stress of everything. Okay, so that's a really loose word, isn't it? But I think because there were so many cases, there's so many things going wrong, it's such a litigious thing now, unfortunately. So everybody works defensively. There was just like this level of tension and anxiety all the time.
Ros McFadden was a senior midwife but gave it up to run a breastfeeding support group. And when we asked the new mothers there for their experiences, the picture was of a service struggling.
My midwife who was assigned to me openly told me that she didn't want to be a midwife anymore, and she was actually trying to actively get out of the profession. And
my assigned midwife, like that lady also said, I loved her, absolutely adored her, but she was very disenchanted with the NHS. And she was just fed up.
I was extremely short-staffed to the point where you're sort of reassuring them. It's like, okay, yes, I have waited 8 hours for paracetamol to be delivered, but, you know, I know you're short-staffed, so don't worry about it.
And one of the survey authors has said she too supports the call for a national public inquiry.
Something has to happen now, and when we say now, we mean yesterday, to turn this ship around. Because obviously you do get a vicious cycle. You know, if you get people leaving, then you get more people under stress, then you get more people leaving, and so on and so forth. We have to turn that up towards a virtuous circle. And the only way we can do that, it seems to me, is by having a national conversation about this.
NHS England said they were increasing investment to grow the maternity workforce, strengthen leadership and improve culture, and that the number of full-time midwives has increased by over 600 on the last year. The Royal College of Midwives said there were only 61 more midwives now than there were in December 2019. So short-staffed and overstretched, and now with questions over how well maternity services are regulated, and with many families left wanting to know, how did it get to this?